Good afternoon, ladies and gentlemen. We will call to order the House Insurance Subcommittee for Tuesday, April 13th, the year 2021. Shelley, will you please call the roll?
Representative Subcommittee. Representative Hicks. Representative Kumar.
Here.
Representative Lafferty.
Here.
Representative Mitchell.
Here.
Representative Rutter. Representative Smith.
Here.
Representative Terry.
Here.
Representative Thompson.
Here.
Chairman Hawk.
I am here.
You have a quorum.
Thank you. Chairman detects quorum. We are ready to go. Ladies and gentlemen, as announced, this is our final calendar for House Insurance Subcommittee. And as we look at the calendar, I think it will additionally be our final meeting, absent call of the chair. I think we've done some good work in the subcommittee this year. I want to thank each and every member for your diligence, for your attendance, and what we've been able to accomplish so far. I really appreciate the energy that you bring to the room, the questions that you ask, and the consideration that we've given all issues before. So thank you so much. We do have a calendar before us, and I'll hesitate to give any talk about potential action on some of the bills that may come up until we see what sponsors will do when they get here. But we do have a calendar before us. Item number 1, House Bill 1212 by Chairman Baum. We have a motion and a second on the legislation. Chairman Baum, you are recognized.
Thank you, Chairman Hawk. Here in the state of Tennessee, motorists are required to carry insurance. And yet, in Tennessee, presently, in 2021, over 20% of Tennessee motorists do not have insurance. Although uninsured motorists never seem to hit each other, they do hit insured motorists, and when they do, this imposes costs on us, and we also incur higher insurance premiums. This is a bill that's designed to increase the number of motorists in Tennessee that have insurance, and here's how it does that. In 2017, the Department of Revenue began operating an electronic insurance verification system. This bill would require the Department of Revenue to connect that to license plate readers, which are essentially cameras, along our highway interstates and highways and interstates. And then when these two systems, which are connected, detect violators, they would be able to identify those violators and send them fines. The first penalty in the bill would be a $275 fee. The second violation would be a $350 fee. After the first violation, the violator would get some information about insurance and where to purchase lower cost insurance, as well as a picture of them driving their vehicle without insurance. This is exactly what's been done by the state of Oklahoma, and they have reduced the number of uninsured motorists in their state from 350,000 to just a little bit more than 200,000. I think that this bill will potentially draw some interest from stakeholders, and I know our session's winding down. This committee may be closing, and there may not really be time for everyone to ask all the questions that they'd like, and so I'd like to suggest that we consider a summer study for this bill.
Motion.
Second.
Thank you. Before we entertain that, we do have a couple of questions and comments. Representative Smith, you're recognized.
Thank you, Mr. Chairman. And I just wanted to ask of the sponsor, this sounds like something that needs a little bit of study, not from the perspective of would it work or not, but just from the perspective of what other states have done to address this issue similarly. And when I hear cameras, I think we all think about surveillance, and I think we need to do a little more, get a little more information on that. But one question I do have is the Department of Commerce and Insurance working with you as a partner on this endeavor? Thank you, Mr. Chairman.
Let me answer your question several ways. Some other states have been doing this. Oklahoma is one example, so I think the technology is there to do that. We know it works. I think that there are just stakeholders that have some questions and they want to have time to think about this in a little bit more detail. It's the Department of Revenue that would be implementing the connected systems. And they are working with us on this, but I think that they have some concerns.
Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. I think the question's been answered. I think it's something that does need to be explored and worked on. apart from privacy concerns, what other pushback do you have?
I certainly think privacy concerns would be a primary concern. The Department of Revenue may have some concerns about whether using certain cameras this way would be in violation of federal department by federal Department of Transportation standards. Now, there are some cameras that maybe the federal government hasn't authorized to be used that way, but it's not. But I think that the Department of Revenue could pay for their own cameras to be installed that could perhaps be used to connect these two systems and implement this program. But there is some uncertainty on the Department of Revenue's part as to whether the Federal Department of Transportation would permit this.
Thank you, Mr. Chairman.
Thank you. And thank you, Chairman Baum. I think I did hear that you wanted to have this as close to a true summer study as possible. I want to give you a couple of thoughts and a couple ideas as you do look forward to that study. One being with the Department of Revenue, how up to date is that database? How up to date is that information? Is the insurance information that we have available? And that's important both for this potential legislation, but for enactment of current legislation as well, as law enforcement stops a driver for a primary offense, and then the potential secondary offense of not having that insurance card with them or not being fully insured, just to make sure that the data correlates and we're all playing on the same page. So I would encourage you to check on that. Also, the possibility, and I'm going to take license and brainstorm here with you a little bit. If something like this or an offense of this nature could be a primary moving violation as opposed to a secondary moving violation right now where someone has to be pulled over for speeding or lights out or something like that, then they can check and see if they have an insurance card or fully insured or not. I don't know how that happens. I don't know how that potential to be pulled over as a primary offense of not having insurance, absent having that card reader, but if you've got, the tag reader, but if you've got law enforcement paying attention and they see a particular tag and want to run it through a database themselves, that may be of value to you as well as you look at this. I think we do have some concerns, as Representative Smith said, about surveillance and what that does look like. But if you could have a manned vehicle that is paying attention to tags, maybe that helps some small way. Seeing that we have Chairman Terry, you are recognized.
Thank you, Chairman. You threw out some statistics. I know we're trying to get this to a summer study, and you and I can probably talk off the record. You may not have these statistics, but obviously with uninsured motorists and the amount of wrecks that have been caused or whatever, do you have a dollar amount and a life amount of cost to Tennesseans on that, or is that something that we're just going to need to ferret out during the summer study?
The statistics I have for you are that a little bit over 20% of all motorists on the roads in Tennessee are projected to be uninsured. And that makes Tennessee fifth or sixth highest in terms of the percent of motorists who are uninsured. Now, whether the number of cars that translates to, I don't know off the top of my head, but there is a fiscal note on this bill that attempts to project some of that. Actually, the fiscal note would suggest that the fees from this program would actually generate additional state revenue. But that projection is based on a certain number of motorists on the road, and so if you look at the fiscal note, I think it'll have a projection for the number of cars, that is. But as a percentage, on a percentage basis, it's close to 21%.
All right, thank you. Look forward to working with you on that. I'm sure a significant portion of those are on that I-24 corridor that you and I come up every day.
I renew my motion. Chairman Ball, the motions for a summer study. All those in favor, please signify by saying aye. Any of those opposed, please say no. The ayes have it. We will talk with the Speaker's office and try to get you as close to a real summer study as we can. I think that the Senate is going to be discussing this issue as well.
Great. Thank you all.
Thank you, Chairman Baum. All right, ladies and gentlemen, we are now looking at item number 2 on our calendar, House Bill 451. It's going to give the representative opportunity to come and talk on the bill if he likes. I think the request from Representative Hodges has been to roll this bill to the first calendar of 2022. I'm told that is accurate. House Bill 451 will be rolled to the first calendar of 2022 without objection. We're now on item number 3 on our calendar, House Bill 932 by Representatives Chisholm and Lamar. Motion. We have a motion. We have a second. Lady Lamar, you are recognized.
Thank you so much. This House Bill 932 is a piece of legislation that adds doula services as a kind of medical service to be provided by TennCare enrollees. Requires doula services to be performed by a person who's received the necessary certification to provide these services. Earlier this year, we passed a House Joint Resolution that recognized doulas as vital members of the birthing team because of what they've been able to do to reduce infant and maternal mortality. This week is Black Maternal Health Week, which brings awareness and acknowledgement to the disparities experienced by many of our women on TennCare, given that most of the women on TennCare are African American, that the Maternal Mortality Review and Prevention Act of Tennessee has found that we are 3 times more likely to die than white women, and our children are 3 times more likely to die, and 85% of these deaths were deemed preventable by the Maternal Mortality Review and Prevention Act and the committee that was established here in 2016 by the General Assembly. With that, that's an explanation of my legislation, and I understand we have a speaker here, and I would like to let them address the committee, and then I will follow up with some additional comments.
Before we go on, Representative Smith, you're recognized.
And again, this is just an inference on my part, but am I hearing you say that TennCare has an inadequate network, or there's an inadequate network of OBGYN services to individuals? That's why we have to have these other certified individuals providing obstetric and gynecology care. Thank you, Mr. Chairman.
Lady Lamar, you're recognized.
Thank you so much. Currently in our rural areas, there we go. Currently in our rural areas, access prenatal care is very, very limited. Tennessee is a mostly rural state, as we know, and 47 of the 95 counties lack an OBGYN. So if we can add some necessary support to the birthing team, especially for members throughout the state in our rural areas, I think it would truly be beneficial for the women in our state. And over half of the women who give birth in the state are on TennCare coverage. So we can, allow them to be able to provide additional services. It's going to help service the rural areas. I think that would be very beneficial to our women and our birthing teams.
Thank you. Chairman Subcommittee, you're recognized.
Thank you for this. Just want to make sure that we can pay them, right? Through TennCare, we can pay the doulas?
Now?
If we pass this bill, we're able to pay them, right?
Yes, it will be reimbursements, yes.
Thank you.
Thank you. We do have folks from TennCare on the list to speak on the legislation. Without objection, we will go into recess. And Ms. Reed, if you could introduce yourself, tell us who you are and who you're with, and express your thoughts on House Bill 932.
Thank you, Mr. Chairman, members. So the current posture of the bill in the TennCare position is flag philosophical and flag fiscal. Doula services are not currently covered by TennCare, so this would be an insurance mandate that would add that service to the list of covered services. They're also not licensed professionals, which makes it more challenging for MCOs to contract with them. Then, of course, there would be a fiscal impact for requiring coverage of this. I did have a brief conversation with the sponsor right before committee. They mentioned maybe making this something optional. What I communicated to her was I was happy to take that back to our team. As long as the bill is in this posture, though, and it is an insurance mandate, we would maintain the philosophical flag and the fiscal impact.
Thank you. And this may be a question for Department of Health. Licensure of these individuals, Is that as the sponsor listens as well, I don't know if that's an opportunity or a possibility that there be some type of licensure created for doulas in the state of Tennessee. If there may be precedent in other states, there may be value to that as well. So, any questions of TennCare? Chairman Terry, you're recognized.
Thank you, Chairman. Could you speak to the comment about was it 47 of the 95 counties don't have an OBGYN? Can you?
Oh, I'm not, yeah, I actually don't have that data in front of me. I would need to go back and try to pull. We do have adequate networks, though, for all, services for pregnant women and postpartum. Doulas are just not covered, but there are a wide variety of services covered, and there are adequate networks for OBGYNs.
So when you say adequate network, what does that mean to you?
So that's that community standard, I think, that we talked about last time, which I think PCPs, I'm not sure if they're considered PCPs or specialists, but PCPs are within a 30-minute radius.
Does that mean an OBGYN is within a 30-mile radius, or a primary care provider that is trained in obstetrics to take care of them, or is in that area?
Yeah, I'd need to go back and see if they're qualified as specialists or primary care physicians. To the extent that they're specialists, 75% of our members have to have access within a 60-mile radius, and then 100% of members within a 90-mile radius.
Okay, thank you.
Chairman Kumar.
Yeah, thank you, Mr. Chairman. Now, you were talking about making it optional. What does that mean?
That is what I would need to take back, really, to our folks at the office to see if there was some sort of language to work with the sponsor. But the way the bill is drafted as the insurance mandate would be problematic. But yeah, and what I told her as well is I don't have any guarantees, but she asked us to take a look at it. So I'm happy to take that back to the office.
Do you have any ideas about how it would be optional? How will you pick and choose?
No, I would have to take that back.
Thank you, Mr. Chairman.
Chairman Subcommittee, you're recognized.
Thank you, Ashley. Thank you for coming here today. Is this bill in the same kind of position as a bill that I ran earlier in the year,
It would.
where it's a mandate?
It's a mandate, yeah.
And therefore, we would have to go through the whole TennCare negotiation process to be able to see if we can even do this. But if we change it to where you may be able to cover it, then you leave it at the discretion of TennCare and the MCOs to try to figure out how to work through that.
That could be an option possibly that I would take back, is that you make it a may instead of a shall.
Because I think on the, sorry, Mr. Chairman. Is it okay? I believe the position that the bill I had was in, when it became the may, then the department got neutral on
Yep.
it. And then therefore, we just had to find the money to fund it.
That's right, yes.
Okay.
So I think something like that is what I would take back.
Thank you, Mr. Chairman.
Chairman Terry, back to you.
Thank you. But to follow up on that, the difference in the bill that we had earlier this year, these are not licensed.
That is correct. They are not licensed.
Thank you.
Yes, that does add an extra element of, concern that I will need to talk through with our team.
Representative Mitchell, you're recognized.
Yeah, I'm just curious, does TennCare cover midwives?
I believe we do. I will double check, but I'm pretty sure we do.
I thought so.
Yeah.
And they're just certified as well, correct?
Are they? Okay, yeah, I would have to double check, but I'm happy to do that.
Okay, thank you.
Chairman Lafferty, you're recognized.
Thank you, Chairman. I've heard the term midwife all my life. Doula is a new term. Could you give me an idea what the distinction between the two are?
The sponsor may be, yeah. I believe they provide emotional support before, during, and after a pregnancy. Yeah.
Any further questions while we're in recess of TennCare? Seeing none, we're back in session. We will go to Chairman Lafferty to restate his question to the sponsor of the legislation. Chairman Lafferty, you're recognized.
Thank you, Chair. Yeah, I'd heard the term midwives all my life, and I guess in my mind had an idea of what that is, but this term you've brought today for this bill is a new one to me. So could you give us an idea what the differences are, please?
Absolutely, I would be happy to. Doulas are important to women because their sole purpose is to provide physical, emotional, and informational support during labor and birth without doing anything medical, excuse me. So they help provide physical, emotional, and informational support before, during labor, and postpartum. During labor, they are your advocate to your doctor. A lot of times, women don't have family or anybody to support them through the birthing process. Doulas step in and do that. They are able to articulate when you're in pain. They are able to help you understand what do you need during the birthing process. Before birth, they also come up with eating schedules for you. They go to your appointments with you. They do anything support-wise to help the mother ensure she has a steady and effective and safe birthing and labor process. They also support you afterwards. They teach you how to breastfeed your baby. They teach you how to put them on a sleep schedule. They help you with your recovery, especially if you had a C-section. They even go as far as to change you, everything you can think of. The difference between a doula and a midwife is basically they do the same thing, except the doula doesn't actually birth the baby like a midwife does. Again, they both are not licensed, they're certified, but research has shown that doulas reduce the amount of women who die, reduce the amount of women who lose their children, and they reduce the amount of women who have to have C-sections, which is more costly than natural births. So if we do implement and support doulas, we save money because there's less women having C-sections, which is major surgery and tend to cost 10 times as much as a natural birth. So that is the role of a doulas. They have been around, but they have now become more known with social media, the internet, and us becoming more educated about the disparities women are going through regarding the birthing process. So as we become more educated as a society around the difficulties women experience through the birthing process, the more support and the need for doulas has begun to rise throughout the last couple of years. Also, I want to add that currently, 3 states have passed legislation to reimburse doula services through Medicaid, which include Indiana, Oregon, and Minnesota. New York has launched a pilot doula program for Medicaid beneficiaries in certain areas, and several other states have also introduced Medicaid coverage of doula services, which include Arizona, Connecticut, Illinois, Massachusetts, New Jersey, Rhode Island, Texas, Vermont, Washington, D.C., and Wisconsin.
We've got a list. I'm going to start with Representative Thompson, then Chairman Terry, then Chairman Lafferty. Representative Thompson, you're recognized.
Thank you, Mr. Chairman. Is there any formal training programs for doulas? Could you maybe explain those?
Yes. In order to be a doula, you have to be certified. So there are training programs here in the state and across the country that provide the training for doulas so they can be officially certified. So no, I can't. One day, I love doulas, obviously, but I can't say I'm a doula without actually going through the training and being certified. Just like you can't become a real estate agent without going through real estate course, taking the test, getting certified. You can't be a nursing assistant without going through the necessary schooling and training and getting certified. So yes, they do receive the necessary training to do this, and they are considered experts in the birthing process as well. So yes, sir.
Chairman Terry.
Thank you, Chairman. And this, I think, is a good discussion to have, and I think we probably need some more clarity on the issue. And I may not have all the correct information here, but a midwife is an advanced practice nurse. A certified midwife is an advanced practice nurse, so they've gone through more extensive training, whereas a lay midwife is not. And my understanding is a lay midwife, which is similar to a doula, is not recognized here in the state of Tennessee. So, so from that perspective, I do think that, I appreciate the discussion on this. I do think that we probably need some more information for the members on this and what process there may be to create a license or something along those lines before we go down that road. But thank you for the discussion.
Representative Lamar, I'm going to read something that the Legal Services brought to me, and then I'll go to you. Title 71, Section 5, 107, subsection 23. nurse midwife services. Midwife services are performed by a person who is licensed by the Tennessee Board of Nursing as a registered nurse under the authority of the Nursing Practices Act, and then additionally certified by the American College of Nurse Midwives. So there is a licensure with the Board of Nursing, and then there's a certification as well. So it is dual. Representative Lamar, you're recognized.
Thank you so much. Thank you more for the clarification. What we do have to get doulas licensed. I think that as we stated earlier this year, they are vital members of the healthcare team. I wasn't aware of the pushback until 15 minutes before committee from TennCare, so I never really had an opportunity to indulge in a conversation about any pushback or what is to be done or not to be done. But because I think this bill is such an important issue, and I think that is something that we must get to a place where we are supporting doulas, I would love to roll this to the first calendar of the year so I can give TennCare an opportunity to talk with us. I know they was able to talk with many of you all, but I didn't have a chance to really indulge with you all and them on this issue, but it is important, and we want to make sure that we are continuing this conversation, especially in honor of Black Maternal Health Week this week. We want to make sure Tennessee comes from the bottom of the nation when it comes to ensuring our women are able to make it through the birthing process. So I would like to, if I can, make that request, Mr. Chairman.
Yeah, and I think as you can tell, we're all concerned. We're all concerned about mothers-to-be. So we've got a couple on the list. I know that Chairman Lafferty had a question, and Chairman Kumar have a question, and then we may have continuation motion. I want to go to Chairman Lafferty first.
If we're going to roll the bill, I'll wait.
Okay.
Chairman Kumar, did you have anything?
Yes, thank you, Mr. Chairman. And I sincerely think it's a good thing, in the sense that when you're talking about selectively bringing it, one way to start may be a pilot project, and selecting mothers who are very young, pick an age, who are inexperienced, don't have family support, and mothers who are first-time mothers. So I think those people will benefit from the wisdom and support from a doula, because a young teenage pregnant is going through a lot anyway, and they may not have the family support, they may not trust their parents, and a doula would do well. I can see that in that situation. I also have one other humble request. I'm struggling with how to put it, and I hope I don't get me in trouble. But sincerely, if there are 47 rural counties in which there is not an OBGYN, that fact affects African Americans and others as well. So let's not isolate it into an African American issue. Let's help the young teenage mother, no matter what her ethnicity or race is. And I mean that sincerely. Let's not color this. That's not okay. It also has, let's not make that type of an issue. It is taking care of Tennesseans who are in a difficult spot. And I think, again, given that situation, a doula would be a good thing. Yeah, thank you. Thank you, Mr. Chairman.
Can I respond?
Representative Lamar.
I appreciate your comments. Thank you. And you're right. This is a week that we're bringing awareness to a certain demographic that's definitely has been on the negative end of many of these issues. And obviously, I have my own personal story about I wish I had a doula the whole time, and maybe things would have turned out differently for me. But you're right. Doulas can help everybody. I agree, from our rural areas to our rich, to our poor, to our middle class. And I remember you all supported my bill that will extend the Hope Scholarship so that women can take a year off to have their children. You're right. They probably could use a doula and be more prepared to re-enter college and keep their Hope Scholarship. So if I can help you in coming up with ideas to create that pilot program like they're doing in New York and across the country, I would love to. And I would love to have the committee support around their issue, because it is important and it can help all women. And there are so many amazing doula organizations in the state. Here in Nashville, got Music City Doulas. In Memphis, I've worked with Peak Wellness and Healthy and Free Tennessee, who are all committed to ensure that all women have justice in the birthing process. So I appreciate your comments, and I agree. I think that all women could definitely benefit from a doula services.
Thank you. The chair has heard a request to roll this bill to the first calendar of 2022. Representative Mitchell, you're recognized.
Yeah, I've got a question on that, Mr. Chairman. You know, I hear we say roll it to the first calendar of the next year. Is there any way we can just roll it to next year? I think a lot of people roll it to the first calendar of next year. Then they get here the next year and they may not have done everything they need. And then they've used one of their calendaring, and then that limits a member from the times it can be calendared. So is there any way we can just roll it to next year?
Thank you, Representative Mitchell. The other proper request would be to take this bill off notice, and then you can put it on notice whenever you're prepared to have the conversation next year and when we convene.
Committee, can I take it off notice, please?
Yeah.
Okay. All right. We'll clarify from the chair. The chair has now heard the request that House Bill 932 be taken off notice. Without objection, bill's off notice. Thank you very much. We look forward to working with you next year. Thank you. All right, we are now on item number 4 on our calendar. House Bill 1453, House Bill 1453. I think Representative Thompson has taken this bill over for Representative Potts. Representative Thompson, you are recognized.
Thank you, Mr. Chairman. And I just got this just a few days ago. Yeah, I think there's a lot of good things this can do in giving us a healthier Tennessee, and in the long run, really reducing a lot of TennCare cost. But I'm sort of like everyone else today. I really need to do a little bit more work on this bill, and I think I would like to do like Representative Lamar and ask it be taken off notice for now, and I hope to bring it back in January.
All right. Without objection, House Bill 1453 will be taken off notice. Thank you very much, Representative Thompson.
Thank you.
Ladies and gentlemen, we have worked our way through the calendar. Do we have any personal orders, anything for the good of the order of the committee? Chairman Terry, you're recognized.
Thank you, Chairman. I just want to thank you for your leadership this year. This has been an efficient committee, and you've put in a lot of hard work, and I just sincerely want to thank you for the work that you've done on this committee. Thank you.
Thank you very much, Chairman Terry. Thank you. Thank you for the opportunity. Some days it didn't feel quite as good as other days. I appreciate the opportunity to be with you, to try to head us in the right direction on issues that have come before us. You've been a tremendous committee. The information shared has been very valuable to me as a legislator and as a person. I feel like I've grown greatly in listening to your conversations, and I appreciate the opportunity. Any more business to come before this committee? Seeing none, we will be Insurance Subcommittee, House Subcommittee will be closed to the call of the chair. We are adjourned.